Shelby for inviting us here. It is true I'm on vacation tomorrow. I learned when you married an elementary school principal, your job is to make sure that the week after school ends, you have a vacation lined up. So we are heading out of town tomorrow. But thanks for inviting us, Shelby. I think when I first met Brig, several months ago, I think I've been talking nonstop about Lindale and how important it is and how special this place is. And so I'm excited to have an opportunity to have him out here. I am, of all the things that I get to do, being a part of the School of Medicine is probably the most favorite thing, other than watch my girls dance at Studio 16. Being a part of the School of Medicine is one of the best things I can do. So there's a lot I can say about Brig. Let me just share two things with you. One is Brig could be doing a lot of different things. He is a pediatric critical care physician by training, which means he takes care of the sickest of the sick kids, has had a great career at some of the top places in the country dealing with really sick kids. And so when the Tyler School of Medicine opportunity came along, trust me when I tell you that this was a guy that could be a lot of other places, but wanted to be here. And that's the most important, one of the most important things I can tell you is that he wanted to be here, and he'll tell you a bit more about why. The second thing I can tell you is the guy is passionate about community-based medical schools and how we can take a medical school like a UT Tyler School of Medicine and serve communities like Lindale, so that the students who graduate from Lindale High School have an opportunity to go to medical school right here in East Texas, never leave home, and return to practice in places like UT Health, Christus, Bethesda, you name it, right here in East Texas serving their community. And so it's an amazing opportunity to have him here. I'm thrilled to call him my new boss. So if you see him after the thing, say nice things if you can about me. And otherwise, I'd like to introduce you to Dr. Brig Willis, who's our inaugural Dean of the School of Medicine.
Thank you so much, Daniel. And we're partners, colleagues. It's not a boss. Thank you all for being here, first of all, and for having me. It's an incredible honor. Getting out and engaging with the community is really amazing. I've been through 4 startup medical schools, and what Daniel says is exactly right. The community support for this particular one is unparalleled. I've never seen a region and communities more excited about this and more willing to help and support. And just you guys having me out here and that you're interested in this is great evidence of that. And it's so wonderful to be at an event with all these different healthcare facilities speaking. I mean, we as a School of Medicine are here to serve all of East Texas. And so we hope to partner with Mother Francis and hospitality. And I've already met with Dr. English about working with the Bethesda Clinic, and we're trying to engage with all of the healthcare providers in the area because, and I'll talk about this later, the whole reason I'm here, the whole reason the school is here is to help East Texas, all of East Texas, right? So we're a resource for the whole community. So thank you guys for having me here. I have slides, just as a point of reference, some cool pictures, some information about the school. But I'm a big active learning fan, as you know, your wife being an educator. People don't remember anything from me just standing up here and doing slides, so I'm gonna be calling on people. I'm gonna be like engaging with you guys. You know, any questions, just shout them out. It's very informal. Because, does anyone know the percentage of information you'll remember if I just stand up here and point at slides? What do you think?
20%.
20%. Anybody else? 10. Closest without going over. 5 is right. Nailed it. So you only remember about 5%. So if you only remember 5%, remember this. School of Medicine is for the community. Right? Very easy. Okay. So to get started, I'm just going to go through the school, why we're here, what we're trying to do. Again, if there's any questions, please jump in. I have to ask one question. Gentleman in the red shirt in the back, you look exactly like my rock climbing partner of 15 years. Your name's not Fred, right? You're not? Okay. I just had to ask that. Because if you want to rock climb, you're in. So I'll start off just a little bit about me. Actually, can you put the slides as they go for me?
Yeah, absolutely.
I like to walk around. I don't want to be tied to the thing. So a little bit about me. Daniel mentioned, you didn't make the joke you were going to make.
I know, I decided I'd be nice.
I grew up in California. So don't throw things. Don't. I know, boo, I know all that stuff. Thank you. There are a lot of good people in California. There's a lot of great stuff going on there. I did grow up. What's that?
You're in Texas too.
I am in Texas now. Why do you think I'm here? Gotta go to where it's good, right? I did grow up in a very small town. It's probably smaller than Lindale. How many people in Lindale? Anyone? 8,000? Is that right? Okay. Yeah, so my town was 8,000. It was a farming community. Our biggest crops were sugar snap peas and artichokes. So I have my graduating class in high school is 80 kids, and I'm going to talk about how that informs what I'm trying to do with admissions, what Daniel talked about, getting kids from communities like this. So I do have, despite the California thing, pretty deep ties to small town and rural type areas, and that's why it's really one of the reasons I'm excited to be here. I did train all through California, UCLA, UCSF, Children's Oakland, which is a community-based residency program, pediatrics in Oakland, Children's LA for fellowship. But my first faculty job was at UT Southwestern, just a little ways west of here. And then I was in Arizona for about 15 years, and I actually moved here. That's where my residence was before I moved here. I was working my most recent job was University of California, Riverside School of Medicine, which I can also talk about if you're interested, a very focused, community-based medical school in the Inland Empire of California. So I've been all over the place, happy to be here now, trying to do something amazing for the community. So that's sort of the summary. I'll get to the slide. So first slide, the first question I always get asked is, why do we even need a medical school? There's medical schools all over Texas, right? Why do we need more? And the reason is, the biggest way to get somebody to come practice in a community and stay in a community is to be from that community. And we need more doctors in East Texas. If you look at the numbers, I won't show the numbers of physicians, but we have one of the lowest number of physicians per capita in the country in East Texas. Now, I'm not talking about Smith County very much. Smith County, if you look at it, it's like a little island. There's pretty good health outcomes. There's a lot of doctors, as you probably know. But the entire region of East Texas needs service. It needs physicians. And so we need to produce physicians here from kids from the Lindale School District to go to medical school and they want to stay here and help the communities all the way throughout East Texas. So shortage of physicians. Dire health outcomes. I'm going to show a statistic about that. If East Texas lumped together, it's about the size of West Virginia, we're a state, it would have health outcomes across the board that rank between 48th and 51st in the nation. Stroke, heart attack, hypertension, you name it, it's not good, right? So we need to address those health outcomes, and one of the ways you do that is through training health professionals. And we need better access to healthcare. I love what I'm hearing today, expansion of facilities, trying to get more people the access to healthcare that they need, and that's what we're here to do. We're here to train people and try and serve that need. Okay, so the health outcomes, I talked about this. Our rankings are not fantastic. Mortality rates for East Texas were higher than Texas and all these things listed there. It's not good. We have to do something about it. Next slide. If you look at this graph, again, you're not going to remember a lot because I'm just standing up here talking mainly. But if you just look at that graphic, the dark color is bad, right? The dark color means bad health outcomes. And you look, it's very, very dark across East Texas, right? Us, very, very West Texas and Rio Grande Valley maybe, but East Texas has the most dire health outcomes, so we need to address that. Next slide. Physician shortage. The demand for physicians is actually growing, even though we don't have enough right now. It's going to be growing. In general in America, we have an aging population. The baby boomer generation needs. The doctors who are in the baby boomer are retiring, and so we have to replace them. And actually, my generation has a lot fewer people, so we have actually fewer doctors. So we need to do something about that. East Texas specifically is actually growing. Tyler, this whole area, Lindale, everyone is really growing here, so we need more doctors for the whole region. And then there's further challenges, right? We're always competing with Dallas, Houston, Austin, all those kind of places for where physicians want to practice. So we need to have something here to serve this region. Next slide. What really matters? So I'm talking about, we need to make doctors to address health outcomes. And how does that actually work? We're going to have a class size of only 40. So how are 40 doctors a year really going to make a difference in the East Texas region has 2 million people? And what I would say is that by having those doctors be the nexus for a team of healthcare professionals that are addressing the things that matter and changing people's entire way of life. Because if you look at the things that actually affect people's health outcomes, medicine and medical care, all the stuff, it's great that we're doing this, it only accounts for about 10 to 20% of how healthy you are. Vaccines, medicines, antibiotics, all that stuff. Surgery, it helps, obviously, but it's only about 10 to 20%. All the other stuff in your life actually affects it a lot more. Whether you smoke, what your diet is, how much you exercise, all those lifestyle kind of things. So what we need to do is focus these doctors as being the center of a team of people who are focused on changing people's lives, giving them the tools that they need to be healthy individuals. And that's what our schools can be focused on doing, is training these physicians, not just to fix things when they're broken, but to prevent things from being broken in the first place. So, what kind of different focus for care will that be for our doctors once they're out? For example, screening patients who are enrolled in care management for social risk factors, like actually asking patients about that and giving them the support they need, right? Developing local partnerships with cities, counties, community centers, all these different things where patients can access free healthcare. Targeted programs to address specific issues like food insecurity, social isolation, all these different things. This is what really matters, right? Getting people connected so physicians can be the nexus of it, not just staying in their clinic, waiting for someone to come in when they're sick, but getting out there and being engaged with the community. Next slide. So we were already starting to do that. And me being here at this chamber, I want to engage with you guys and everyone in Lindale as much as possible. We've established partnerships with multiple community partners in Tyler already. I've only been here 3 months. I'm trying to do what I can do, but we established the East Texas Food Bank is going to use our school as a teaching kitchen. There's going to be a food pantry there. We're working with St. Paul Children's Services. Texas AHAC is going to provide specific curriculum for our students so they can learn about community health. Family Circle of Care is one of our really engaged partners right now. So we're trying to make the School of Medicine as deeply embedded within the community as we possibly can. And anyone who has any ideas, and anyone here who wants to engage with the school and extend what we're doing throughout the community, that's what I want to hear about. So there's a lot of words on this. I can send you these slides if people want to look at them later. But I had to write the vision and the mission and the stuff about the school, about why we're here. I'm not going to read the whole thing, but if you look at the bolded parts, what we're focused on are improving the quality of life and reducing health disparities in our rural region. And everything we do is focused on that. Partnering with the community to address social determinants of health. What I just talked about, right? How do we actually change things? And then on the right, in our mission, every single part of our 4-part mission, which I'll make a point about, every med school in the country has a 3-part mission. Teaching, research, and clinical care, right? We're 4. And number 1, if you look on that list, is community engagement, right? That's actually number 1. So on every part of the other 3, teaching, clinical, research, how does what you're doing in those areas engage with the community, value add to the community, and actually change things on the ground right now? We're not going to be some ivory tower just all by ourselves, like doing research and using the community. We're actually engaging with the community, we're going to be part of the community, and we're going to make it better. And that's what I want everyone in the school thinking about every day. So the foundation of starting a med school. I've been through 4 startup medical schools. I know I'm crazy. Why are you jumping into starting up a new thing? This situation is the strongest foundation for med school I've ever seen. Every other one was missing some factor. Community support wasn't that strong. Competing medical schools, not having a strong clinical partner base, not having good research, not having allied health training. We have all of that. We've had GME for many, many years. We've had students coming from UTMB. We have incredible basic science research. We have strong clinical research, incredible health resources that we've talked about today. This is an amazing situation. We're going to do great things with this medical school. All right, so a little question before I talk about what kind of students we're looking for. Who here has been to the doctor ever in their life? Most everybody. Some really healthy people haven't, apparently. Somebody tell me a characteristic of a doctor you want when you go see a doctor. Attentive. Good.
Bedside manner.
Kind.
Bedside.
Good bedside manner.
Sincerity.
Sincerity.
Smart.
Wise. Smart. Well trained. Listening.
One I can understand.
Excellent.
Empathy.
Empathy. Fantastic answers. How many of you guys when you went in to see your doctor, ever knew what their GPA was in college? How many know their doctor's MCAT score? No, right? Everything we look for in physicians is based on empathy. Obviously, you want well-trained, you want smart people. What's that?
To pass the board exam.
You got to pass the board exam. But let me tell you a little fact here. We're going to have 40 seats for students. Small class, you want to have to be well supported, be well trained. How many applications do you think we're going to get for those 40 seats? How many? 1,000? Closest without going over again. 100? 1,200? It's about 6,000. Wow. All right, so 6,000 people for 40 seats. I guarantee you every single one of those people, and about 5,000 of them, all have GPAs around 3.9 and MCATs that are off the... Everybody has good academics. The number of people applying to med school have good academics is ridiculous. Every single person who goes to our med school is going to be incredibly smart. They're going to be very smart. They're going to be able to succeed academically. But that's not what I'm looking for, right? Just because you have a good MCAT and you have good GPA says nothing about what kind of a person you are. Whether you're empathic, whether you have good listening skills, whether you're kind, whether you're attentive, everything you guys just said. That's what we're focusing on with our admissions. Next time. So what are we doing? We have 4 things we're really trying to find in our applicants. Number 1, are they community focused? Our school's completely community focused and engaged. That's what we want them to show us, is that's what they're going to want to do. Are they dedicated to East Texas? We're going to actually preferentially screen for East Texas residents. All these kids coming out of Lindale are going to be wildly preferenced in getting admitted to our med school, because if you want it to be able to deeply commit to coming back to East Texas, it's way more likely if you're actually from Lindale, or you're from Rusk, or you're from wherever, right? If you're from East Texas, you're going to be way more likely to come back and serve, and that's why I'm here, right? We didn't build a med school here and are giving free tuition to all the students so that some kid from Dallas can come down, get free tuition, and go back and do plastic surgery out there. How does that help East Texas? Does not, right? So we're trying to not have that happen. Passionate about preventive care and systems level change. That's what I'm talking about. Having the mindset that I want to change things in a big way, in a grand way, right? Change the life of people in East Texas. And then primary care oriented. Again, specialists are great, but the way you actually make on the ground massive change in a region is through primary care, right? Pediatricians, family care. Yeah.
I'm just going to, real quickly, you mentioned about growing our own doctors
Yes,
as
sir.
a local field. And some of them may not be enough. We may not be able to fill the 40 seats with that. How can we as a community help you engage those people to where they want to stay?
You know what? It's like you're a plant. I'll be getting to that later. The short answer is that we have to assure, number 1, the culture of the med school is focused on primary care, preventive care. Even if they're not from East Texas, we want people who are passionate about that. And then we got to keep their debt load real low, so they want to do primary care. And then while they're here, we want our students out meeting people like you guys to just start loving the community. So as much engagement and involvement with the community as possible. Once they come, who would ever want to leave East Texas once they got here? Like nobody, right? So we'll engage them as much as possible, but I'll get to that later. So 4 pillars of our admissions. I'm going to go through these kind of fast. You can ask me specifics if you want. Academic preparation index. We're using the GPA and MCAT there's data on this. We know with a 98% likelihood who's going to finish med school based on their GPA and MCAT. So we're just going to tier them based on what their GPA and MCAT are. We're going to know who's prepared and who's smart and all that kind of stuff. Next one. Connection to East Texas. So we actually have already gone through this process. We broke down every single county in East Texas and defined them as East Texas or East Texas adjacent, and broke them down into their various demographics and all these kind of things. And then each student is going to be ranked on depth of connection to their particular county. Did their parents live there? Did they go to high school there? Did they go to college there? All those kind of things. And then so you get a geo index that says how East Texas devoted you are. Mission-centered index, focused on students who are representative of East Texas. We are trying to, there's a very large population of less advantaged background students throughout East Texas. We're trying to help them get into our school. But then experiences, leadership, community service. Since we're de-emphasizing, since everybody has good grades, de-emphasizing grades, it's all about how much did you serve your community, how much leadership did you do, all those kind of things. And so we want a class that represents everybody. This last part, the 4th pillar.
Okay, now it's the 4th pillar.
Yeah, sorry. I'm going back and forth. I'm torturing Shelby today. It's kind of a unique thing. Since we're de-emphasizing grades and everybody here was agreeing that we needed empathy, kindness, attentiveness, all that, we're actually having every student do a situational judgment test. I don't know if everyone's heard of those. It's a test that actually screens for your empathy, ethics, humanism, all these different things. They're video-based scenarios where you have to actually state what you do in a difficult ethical situation. Incredibly powerful, great data on it in terms of screening for people who have good bedside manner, have good empathy and all these things. Yes, sir?
So how early do you start to reach out to the students to make them aware of the school? High school, junior high school, and then what kind of examples of that have you used in the past?
Excellent question. So as early as possible. So one of our big things, we're actually appointing an entire office in our med school to head up Pathways, which is going to have on-the-ground engagement throughout East Texas at the school district level to have counselors and coordinators go to all the different school districts and generate interest, knowledge, and self-awareness that anyone throughout East Texas has the capability to be a health professional. And we're trying to extend that not just to doctors, right? We need more nurses, we need more physical therapists, we need more pharmacists, we need everything. So our plan is to have these pathways all the way down to as low as, even elementary school. Because in my experience, for communities that haven't had a med school, haven't had a lot of doctors, haven't had a lot of any of that infrastructure, the number one limitation to students becoming health professionals is self-image that they can't, right? They never see anyone who's a doctor, they never have any support, they have no idea how to get there, and it just cuts it off before they even try, right? So we want to make them be able to think, I can do this, I can try, here's the path to get there. So I guess the answer is very early, we're going to be engaging with superintendents and school districts as much as possible. Does that answer? Okay, next one. So this is just data on the situational judgment test. I can show you a bunch of it, but it's a weird slide, but what it tells you here is that cognitive tests like GPA and MCAT actually have zero correlation with success in the clinical aspect of medical education, whereas the situational judgment test has a great correlation. So that's why we're focusing on that and not so much the GPA. Next. Education, I'm going to go fast through this because I know that I'm going to go way over time if I don't. Basic thing is this picture is actually very representative of most med school classes over the last few years. There's been a huge problem where none of the students come to class. Because if I stand up there and I just talk at them over slides for 45 minutes on renal physiology, they can find that exact same content from probably a more engaging speaker 50 different locations on the internet, right? So why are they going to waste their time sitting there? And then the other thing is we usually record them and then they can stop it and they can look at another resource and augment their learning. So in our curriculum, we're actually banning the lecture. Lectures are not allowed. So the students have a menu of things where they do pre-work. They watch videos, we curate it, we tell them which videos and modules they come in. And when they're in class, they actually have to do problem sets, case studies, case-based education, where they apply so we're trying to have a value add to their education. And a good example of this, so there's a condition called ventricular fibrillation. You know what that is. It's a bad one, right? It's a bad one to have. And it sounds like a crazy name, but if you had to learn what it was with a guy standing at a blackboard, just drawing stuff like that, and just listening, you might not remember it as well as if you were doing chest compressions, taking care of a pseudo patient who had that condition where you'd already studied it beforehand and done engaging sort of pre-work, applying what you need to know. So we're trying to reverse the whole paradigm of how medical education is done. So all the experiences are going to be authentic and meaningful. On the left, that's what our sim lab is going to look like. It's going to have high fidelity mannequins where you're actually taking care of patients with the conditions you're trying to learn. That on the right looks pretty real. It's actually a silicone-based anatomical model. We're going to have really high fidelity learning environments, but to make it as realistic and have as much authentic learning and student agency as possible. You can skip these. If you want to look at the details of the curriculum, it's pretty cool. It's in 3 phases. It's not even 4 years like most. Keep going, sorry. Keep going. Okay, another part, so we're going to have students, we're going to train them really well. They're going to be amazing, empathic people. But to become doctors in the region, they have to do the second phase of their training, which is graduate medical education. So we have a bunch of graduate medical education already. These are all of our programs, the different specialties that we have. we are focusing very intently on expanding all these different things and adding more programs and hopefully every single specialty that serves our mission. So, because the number one thing that predicts where a student will practice, where a learner will practice, is where they do the residency. So we have to have GME in all the things that we want students to be doing here in the region. So we're going to be expanding GME. We're doing it throughout the region. We're starting a program in Jacksonville. We have in Athens. We're going to try to have GME as widely spread as possible. Okay. So a little update on where we are. The Texas legislature obviously approved our school in May 2021. Accreditation is, we're actually finding out June 15th. So I'm a little nervous, but 100% sure we're going to get it. They hired me. I don't know why you went crazy and did that, but they did that. So I'm here, been here about 4 months. We are every day onboarding our faculty. We have a complete team of educators, all our associate deans of student affairs, admissions, all these things are all coming on board. We've got incredible support from the community through both action and philanthropy. And we're really well on the way to where we need to be. This is just a picture when we got our Fair Foundation Scholarship. I highlight that one because it's transformational. All of our students are going to be free tuition and fees for their entire 4 years for the first class. My goal is to have an endowment where every student forever has free tuition. Because to go into primary care, you have to graduate with a low debt load. Imagine you graduate med school. Some kids graduate med school with $500,000 to $600,000 in debt. You're sitting there with a mortgage sitting on you, right? I might need a mortgage just for my medical education debt, right? But if you're sitting there and you're finishing med school and you're like, what should I do with my life? Should I become a plastic surgeon? I'm not trying to disparage plastic surgeons, they're great. But, or neurosurgeon or something where you're making a few million a year, or are you going to be a family physician making 160? It changes your entire calculus, right? 160 is a great amount of money if you have no debt. Right? If you've already got a mortgage when you start out life, you might change your calculus. So we want our students to graduate with as little debt as possible. This, you can't read any of that, I know, but it's a list of everything we need to do to start our med school. And look, we have check marks almost all the way down. That's amazing, we're almost there. Students will come in July 23. We're starting the admissions right when we get accreditation. We'll open the admissions thing and people will be applying. Where is it? I think people kind of know. We're at the North Campus right now. That's where my office is. That's where Daniel is. That's where the med school is going to be for 2 to 3 years while we build a new building. And it's a great facility. We have everything we need: simulation facilities, classrooms, everything. Where will it be? This is not a secret. We bought some land downtown, right near UT Health East Texas, right across the street from it. We don't have any approval from the board yet, but there may be a facility in that location. That's not the building, that picture, by the way. That's a building I built at my last med school. But just to give you an idea of what a med school building might look like. Okay, so right before I go, I wanted to poll the crowd again. What do you guys think the impact of our med school should be? Anyone? Like, what should I do with this thing?
You're talking about economic impact?
Whichever. Any kind of, like, why is, I mean, I talked about why I think the med school is going to be, but I'm curious what Lindell thinks the med school should be.
Improved health.
Improved health outcomes.
Yeah.
Right?
And change those dark colors to.
Change the dark colors, exactly. See, that's that one thing that we remember is that dark, exactly. Back of the room, any ideas?
Opportunities for our kids.
Opportunities for our kids. I love that one. And it's actually something we saw in Riverside where I was. Similar big health disparity region, big issues. And UC Riverside actually became #1 in the country in social mobility for its students, meaning where they started and where they ended up. And that's what I want to do with the school. All of UT Tyler actually is increasing that social mobility to increase the opportunities for them. Exactly.
Increasing equity, diversion, disparity.
Yeah, no. So if you look at our region, we have 40%, probably close to 40% underrepresented groups. We want our entire med school to look and represent the entire region. So exactly. Okay, so next one, I think it might be my last slide. So yeah, all the things, this is in my head what I want the impact of of our school to do. Improve the health outcomes and disparities in East Texas. Again, partner with and enhance the effectiveness of all our different community organizations. Increase social mobility, right, through the region. Improve the university and the regional reputation. It's weird, we're only training 40 students a year, but it's transformational to the reputation and what the university sort of is known for nationally. Generate new knowledge specifically related to issues in East Texas. Like, I want all of our research focused on specific East Texas health outcomes. And then, I don't know if people have seen, you've probably seen the Perryman report. It's expected to generate $1.2 billion. When they told me that, I was like, 1.2 million, that's a lot. That's pretty good. 1.2 billion with a B per year for the area, which is, I mean, I don't understand money very well, but that's apparently pretty good. Okay, that's it. I know that was fast, but I would love to take questions from everybody. Please check out the website. I'm very proud of it. I helped make the new website. It's pretty cool. It describes everything we're trying to do. But if anyone wants to call me or email me, please do. Thank you for listening.